and Sofia Ramos. So welcome, Santa Cruz group. Go ahead.
Okay, hi everyone. We hope you guys had a great lunch. Today our group will be presenting on building futures in farm worker communities. For introduction, we worked this summer with Matthew Spark, who is a professor of politics and global and community health at UCSC, and he focuses on globalization, health equity, and public policy. And we also worked with our second mentor, Svasti, who is a fourth-year undergraduate at UCSC and majoring in global and community health with a biomedical concentration. My name is Sofia Ramos. I recently graduated from Holy Names High School, and I'm a rising freshman at Center College. And I first became interested in global health with a previous research experience with UCSF, where I worked with a culturally grounded parenting program. And that really opened my eyes to public health policy and how important cultural humility was in health. And in college, I hope to major in international studies to better understand global issues and see how I can take that back to communities like mine.
Hello, my name is Eric. I'm a rising senior at Santa Cruz High, and I learned about global health through my experience with asthma throughout my life and how I've battled with it and how I've learned its history and how it affects in global health. I strive to improve my community, especially the Hispanic community around me in Santa Cruz, because during these troubling times, that's what they really need right now.
My name is Tom Sazonahue. I'm a rising senior at Pacific Collegiate School, and I had an early exposure to global health through observing my mom's humanitarian work in Nepal, doing cataract surgery. And I plan to go into applied math, and I want to work in studies involving global health potentially, and focus on the more quantitative and technical side of things. So for a background, let's look at some statistics explaining the farm workers in the US and California. 68% of farm workers are from Mexico, 3% are from Central America, and 1% are from other countries. Most farm workers, which means about 42%, travel over 75 miles for jobs, often seasonally. Approximately 70% of US farm workers are undocumented, 1.2 to 1.7 million people. Many face constant fear of deportation, with 41% entering the US within the past decade. The average education level for these farm workers is 8th grade. 40% have completed grades 1 to 6. 35% cannot speak English at all, while only 30% speak it well. Work often begins at age 12 for some, with low access to long-term education or professional advancement.
So now we're going to talk a little about some major challenges farm workers face, both economically, legally, and physically on and off the job. So we're going to start with income. The average individual farm worker earns only about $11,000 per year. For a family of 3, it's around $16,000, which is well below the poverty line. And a 2022 study by UC Merced found that many farm workers in California make less than $22,000 annually. Most are paid either hourly or by the piece. So for example, 40 cents per bucket, which means that most workers have to perform back-breaking labor just to make ends meet. About 83% are paid by the hour, 11% are paid by the piece, and only 6% of farm workers earn a salary. On top of having low pay, many farm workers, especially those who are undocumented, are excluded from a lot of basic labor protections. So this includes things like overtime pay and workplace safety rights that most workers take for granted. Because of their legal status, many are also denied public benefits and are afraid to report abuse or unsafe working conditions. Healthcare is another major issue. Farm workers often live in overcrowded housing and don't have access to medical services. This makes them especially vulnerable to infectious diseases. On top of that, the stress from poverty, harsh labor conditions, and fear of deportation leads to high rates of anxiety, depression, and trauma. Farm work is actually one of the most dangerous jobs in the US when it comes to heat-related deaths. And during summer heat waves, many workers suffer from dehydration, heat stroke, and even kidney damage. Climate change is making these conditions even more intense and adding more exposure to things like droughts, floods, and wildfire smoke. And finally, pesticide exposure is a huge health risk. Farm workers often come in regular contact with toxic chemicals in the fields, and as temperatures rise, their bodies absorb even more of these chemicals due to open pores, heavy breathing, sweating, and this kind of exposure has been linked to serious health problems like cancer, cognitive decline, and respiratory issues. So when we think about the food on our tables, we have to recognize the extreme conditions and the systemic challenges the people who harvest it are facing every single day.
And so what Professor Spark allowed us to participate and help him with his UCSC team is the Cultivando Futuros initiative, which identifies pathways for farm workers and their families to be able to achieve healthcare and ag tech jobs, to provide better advantages for them and opportunities to get better economically and fight the economic inequalities they face. Some goals we have in this, of course, is the ag tech and the healthcare jobs, as well as support them and their communities through providing applications with allowing them to have a voice and spread awareness overall on how overall on how they're treated wrongfully in their environments and where they live through different employers. This is centered around to just give farm workers voices and somewhere, and especially during a time where they currently don't have one. And it matters for them to face poverty, food, insecurities, and just limited healthcare and climate risks that they're currently facing during these times. For the research project overview, our initial focus was to try and contact some community colleges. Or not, at the beginning, it was to contact high school counselors and email them, at least find 5 each of us. And unfortunately, since we are in summer vacation, we weren't able to find any. But this was essential for trying to have the opportunity to get kids at an early age to have greater opportunities, especially in like the Watsonville area, to just so they could expand to further like opportunities, and especially in healthcare, and not be inclined to this generational like poverty stricken like working in the farms. We plan to talk to the counselors about their work, their caseloads, and how they view student portfolios as being a key in like potentially providing them more opportunities with these e-portfolios, which essentially just show like what their interests are, who they are, less as a statistic like their GPA, and more just like what they are and like what their interests are and what they want to be in life. Yeah, there's some gaps in the support, especially for the students, and their houses don't speak English or aren't very fluent in it. So especially finding help with counselors or other programs, it's very hard to kind of translate it for the Spanish speaking community.
Some of our initial findings, like Eric said, there weren't many responses from the college counselors. And then we also secondarily tried high school counselors, but we got more or less no hits apart from automated messages because it's summer vacation. So this is where we pivoted to our new phase, which is the Campo Sano Health app for farm workers. This was developed by Professor Matt Sparks' project team at UCSC, and it maps farm worker relevant data, such as heat, smoke, water quality, workplace hazards, and things like that. It connects users to bilingual resources. They have an English and a Spanish mode for the app. So things such as clinics, legal aid, education, and more. And it's designed to be mobile, accessible, and community driven. Our current role is we're looking at counties Napa, Sonoma, Santa Cruz, Monterey, San Mateo, and Ventura. And this was evenly broken up among us. And our task was to add 50 plus bilingual, culturally relevant resources, such as legal services, general things, education, things like that. We wanted to build a comprehensive, accurate map of local services for farm worker families. And like Professor Matt Sparks said, We wanted to ensure it was mobile accessible and something that people could use regularly.
So as I was tasked with Napa and Sonoma counties, I was a little unsure at first of how I would go about this since I'm not very familiar with the area. To better understand the resources available to farm workers in these counties, I reached out to a county social services representative for guidance. And through this outreach, I was able to identify several impactful organizations that provide culturally relevant and accessible sources to Latinx and immigrant farm worker communities. So 3 valuable resources I found that I'd like to highlight are Puertas Abiertas, Líderes del Futuro, and the Botanical Bus. So first, Puertas Abiertas is based in Napa, and they serve as a central resource hub for farm worker families. They offer one-on-one case management to help with housing, employment, and healthcare access. They also provide immigration, legal aid, financial literacy workshops, and health education programs that are all in Spanish to make sure they're accessible to these families. Their teams build really long-term relationships with these families, and they help them navigate systems that are often hard to access. So next, Líderes del Futuro focuses on educational and legal empowerment of farm worker and immigrant communities. They provide DACA renewal assistance, college prep workshops for first-generation students, and Spanish language radio education programming that discusses workers' rights, immigration policy, and local resources. They also host leadership development programs to prepare youth for farm worker families to become advocates in their own communities. And lastly, the Botanical Bus is a mobile health clinic that brings integrated, culturally relevant care directly to where farm workers live and work, like vineyard camps or housing sites. And their services include herbal medicine consultations, massage therapy, acupuncture, nutritional support, and somatic therapy. And these are all provided by bilingual and bicultural practitioners, which I think is the most important part. And they also offer community wellness workshops and healing clinics that are rooted in traditional Latin and indigenous healing practices.
So as I said, we reached out to the 10 total counselors unsuccessfully, and that's when we pivoted to locating and entering educational, legal, housing, and food resources in, for me, that was Santa Cruz and Monterey counties for farm workers. I ended up inputting 54 resources, which is slightly more than 50 because I received feedback from the Community Action Board of Santa Cruz for reviewing resources of Watsonville to add and modify certain resources. Specifically, they told me to look out for the PVPSA, Monarch Services, Watsonville Senior Center, and the youth science centers in that area, YMCAs, and Catholic Charities. And that's why I have 4 more resources.
As for my project findings, I was also unsuccessful in reaching the counselors due to the summers. But I was able to locate educational, legal, housing, and food resources in the San Mateo and Ventura counties. I located 24 in San Mateo and 26 in Ventura. I really took interest in investigating in the San Mateo County because I'm very familiar with that area just due to this business I do help my mom with, which I'll get on later. And I also, part of my findings was I surveyed and helped farm workers log onto the Camposano app and asked for feedback. And they also gave me really touching stories. Some of the key findings I did really like was the phlebotomy training specialist over there in San Mateo County. It was a really great way for like healthcare to like get into it, and a really good like way to get trained into it, like kind of like a little bit of like a trade. And I also really like Puente de la Costa Sur, which is very helpful to the people around there in San Mateo, especially in Pescadero and San Gregorio. The people over there are really grateful for the programs like directors and all the people that help them do with food and education and like helping the future generations like reach further places. As for my project findings, every week me and my mother go out on our business with a van and we stuff them with groceries and we stuff them with sweets and we stuff them with food and we go around and sell them to farm workers around Highway 1. These farm workers, unfortunately, they don't have that much access to transportation. So we do provide like any groceries that they can't like achieve like normally because buses don't stop by there as often due to budget cuts. Some stories they did tell me was that they're very grateful for having these little business cards. I went out and handed them out to each and single one. I asked them if they could sign up into the Camposano app, and I just like guided them through how to use the app, how to use its utilities, and find the resources. And a lot of them had a lot of feedback on how there wasn't a lot of resources around the Davenport and Santa Cruz areas. And so they had the cab, which helped Thomas add more resources to the Camposano app. And a lot of them told me a lot of stories how it's like a very scary time for the farm workers, especially right now. So I found it very like touching that I was at least able to help my community a little bit through giving them like an ability to use something at least to help them a little bit.
Some of the things that I gained a deeper understanding of with this project were how difficult it is to find resources in rural areas, as Eric mentioned. Most of the services I came across were in Napa and Sonoma, and were based in cities. So there was often a physical barrier between how these people could access these mental health resources, these food resources, all these different things. I also couldn't ignore how, like Eric said as well, our current political climate is making it increasingly difficult for people to find these organizations, not only because they're afraid to outwardly support immigrant communities in fear of budget cuts or having their funding being cut, but also being targeted by the government as well. And all of this research in turn really opened my eyes to the incredible work that people are still doing to continue to support these communities and all the different ways I can also come into these like fields and support as well. And I lastly wanted to express how grateful I am for farm workers who are dealing with multiple crises, not only this current situation with immigration, but dealing with a climate crisis and all these things that are just multiplying the issues that they deal with. So I wanted to express my gratitude for all the hard work they continue to do to feed California.
I learned a lot of things through this. One is that specifically through Eric's fieldwork in Watsonville and Davenport, that certain factors such as cell reception limit the extent to which our app can be used, even if it's a really good app, right? Like there are just certain limiting factors that you wouldn't first think of. And also, like Sophia was saying, the administration of our country and the state that it's in because of the pivots in policies and the administration of education is a major limiting factor in not only micro things, such as like the crises affecting migrant farm workers, but on a larger scale, the approval of things like grants and programs that would help fix these types of things, specifically during this administration, is a lot more difficult to get through. And it really gave me some perspective on things I take for granted. For example, easy to access groceries and things of that nature, and good transportation and things like that. And I think that we did some really good stuff with the support organizations.
I learned that global health, not only was it about like the entire world, but it could also be scaled down to my community, and how I could also take a part in it, not just through achieving a great career in global health, like Sun and Chris, but also just like helping my mother out and helping these people around me out.
So some of our next steps include updating the app to actually include all of the resources that we input into our sheet so that these resources are easier to access for these farm worker communities. We're also committed to continuing to educate ourselves about this issue and knowing what we can do to help. And we think that knowledge fuels empathy, and empathy can drive change. And most importantly, we want to continue advocating for and supporting policies and resources that uplift these families and defend their rights, especially in these times in our final years of high school and throughout college. Next, we just want to thank our mentor, Matt Spark, and also Svatsky for helping us make this whole program an invaluable experience. We want to thank his team for creating this app that can help people in real time. And we also want to thank the team and everyone here today who helped make this possible. And here are references. Thank you.
Unfortunately, we don't have time for questions for this group. So if you want to, and we apologize for that, that was a great presentation. But if you want to ask them any questions, feel free to catch them on the next break. So we'll move on to the next person.